Hey there and welcome. Look, we've all been in that chair, right? Sleeve rolled up, a tight band on your arm, and then a quick pinch. A blood test feels like one of the most basic, routine things in all of medicine. But behind that simple moment, there's a whole world of precision, science, and even hidden risks. So today, we're going to pull back the curtain on the hidden science of this everyday procedure. At first glance, phlebotomy, which is just the fancy term for drawing blood, looks pretty straightforward. But this is one of those times where looks are really deceiving. Every single step, I mean every step, from how your skin is cleaned to the color of the little cap on the vial, is dictated by super strict protocols. And they're all designed to protect both you and the sample itself. The stakes, they're actually way higher than you'd think. It's a totally fair question. You're probably thinking a little bruise is the worst that can happen, right? But the truth is, there's this complex chain of events that has to go perfectly right to avoid a surprisingly long list of things that could go wrong. And those potential problems really fall into a few big categories. First, for the patient. The risks can be anything from a common bruise to, in rare cases, some pretty serious nerve damage. Then there's the sample itself. Things like contamination can lead to completely wrong diagnoses and treatments you never needed. And finally, for the health worker, a single accidental needle stick can be a life-altering event, with the risk of exposure to pathogens like HIV and hepatitis. So yeah, this is exactly why every single tiny detail matters. Okay, so how do healthcare professionals juggle all these risks? Well, the very first line of defense is a ridiculously meticulous setup that starts long before that needle is even uncapped. It's all about preventing problems before they can even start. Now this is where it gets really fascinating. You see the precision here? This isn't just some quick swipe with an alcohol pad. Nope. It's a very specific chemical solution, applied with firm pressure, moving from the center outwards. And check out the timing. 30 seconds of rubbing, followed by another 30 seconds to just air dry. And the most important part? If the phlebotomist touches that spot after cleaning it, the whole process has to start all over again. And why all that fuss? It's to prevent this, bacterial contamination. If any little microorganisms from your skin sneak into a blood culture sample, it can make it look like you have a serious bloodstream infection when you actually don't. And that can lead to a wrong diagnosis and getting a prescription for powerful antibiotics that you never needed in the first place. Of course, cleaning the skin is just one piece of this safety puzzle. There's also confirming who you are so there are no mix-ups, intense hand hygiene, a fresh pair of gloves for every single patient, and even how they manage that tourniquet. It should never, ever be on for more than 2 minutes. These aren't suggestions, they are absolute, non-negotiable rules. All right, so once the site is prepped, we get to one of the coolest parts of the whole process. That little rainbow of collection tubes. And no, it's not just for decoration. It's a critical, life-saving color coding system. You know, it's almost poetic. Every single color tells a story. It signals what kind of ingredient is inside that tube, a special additive designed to get the blood ready for a very specific kind of test. Getting this right is everything. And this table just lays it all out beautifully. A light blue top, for instance, has sodium citrate in it, which is used for tests that see how well your blood clots. The purple top has a different chemical called EDTA, which is for counting your blood cells. And see the light gray one? That's got sodium fluoride, which literally stops the cells from eating up the sugar in the sample so you can get a truly accurate glucose reading. It's like a tiny, specialized chemical factory in every single tube. But the complexity doesn't stop with just picking the right color. Oh no, you also have to fill them in the correct sequence. This is known as the order of draw, and in the world of phlebotomy, it is an absolutely unbreakable rule. So why? What difference could it possibly make which tube gets filled first? Well, it all comes down to preventing microscopic cross-contamination of those very additives we were just talking about. This standard order makes sure that the additive from one tube doesn't get accidentally carried by the needle into the next one. For example, the EDTA from a purple tube is perfect for counting blood cells. But if even a trace amount of it gets into a light blue tube, it would completely ruin a coagulation test. The sequence is like a firewall, protecting each and every sample that comes after it. And just when you think you've got it all figured out, the rules change depending on the procedure. For a standard venipuncture, a draw from a vein, the order is all about preventing that additive carryover. But for a capillary sample, like a finger prick, it's a different story. Blood starts to clot almost instantly, so the EDTA tube, the purple one for blood counts, is collected first to stop platelet clumping from messing up the results. Now, this idea of adapting the protocol to the patient becomes even more critical when we're talking about the most vulnerable patients of all. Let's take a look at how these rules work in neonatal care, where every single drop of blood is precious and the margin for error is basically zero. The guidelines here are just incredibly specific. For a heel prick, you can only use the sides of the baby's foot to avoid hitting the heel bone, which could cause a really serious infection. To manage pain, they use a tiny bit of sucrose, basically sugar water, which is a safe and effective pain reliever for babies. And all the equipment is scaled down, using tiny little butterfly needles to protect those fragile veins. And this rule, this one says it all. A health worker should make no more than 2 attempts to draw blood from a newborn. After 2 unsuccessful tries, they have to stop and get help from someone with more experience. It's a perfect example of how patient safety and comfort just override everything else, period. In the end, this quote really nails it. That simple blood test is anything but. It's a high-stakes procedure that literally forms the foundation of medical diagnosis. From the 30-second drawing time on your arm to the specific sequence of those colored vials, every single step is a deliberate action, built on decades of science, all to keep us safe and get the right answer. So the next time your sleeve is rolled up, maybe you'll see more than just